Um, hey everybody, for posterity, I think I should just post this video. Um, Obviously, if you're on here, you follow me. My name is Chipo, and I'm a maternal health advocate in Zimbabwe. It's February what is this? 16th, and I just got a call. I was literally sleeping in because I'm always tired doing this work, and I got a call from a lady, and she starts off the phone call by saying, are you the lady who works with traditional birth attendants?" And I'm like, "Well, define work and please tell me who you are." Though she wouldn't tell me who her name is, but she said, "Oh, I work for the Ministry of Health, and we've heard that you are stealing money from traditional birth attendants." I'm like, "What?" So she woke me up. So I lost my proverbial footing, so to speak. I said, "What? What do you mean?" She's like, "Oh, I saw your post on Twitter where you're talking about traditional birth attendants." And then I was like, "Oh, you're from the ministry. I've actually been looking for you because I'm looking for clarification. Please allow me to get a pen and a paper so I know who I'm talking to." Because for me, in that moment, I was happy because I tagged them in my post seeking clarification about traditional birth attendants, whether they should be practicing or not. And coming off of the meeting with the deputy minister, some of the traditional birth attendants that went for that meeting told me that they were allowed to continue with birthing. But as I've always told them, please don't do it until we seek clarification, and not just verbal clarification in writing. So yesterday, when the head of the traditional birth attendants had given me two phone numbers of people to call at the ministry. So for some reason, in my mind at that time, I'm thinking, so this lady has called to give clarification on that. So I wake up, I get a pen and paper, and then I come back on the phone, and then she launches in, "Oh, do you have an MOU with the ministry?" And I said, "Well, we've already put in the information to get that MOU." Before I could even complete it, she's like, "Oh, so you don't have an MOU?" And I said, "But we're in the process." "Oh, so if you don't have an MOU, what you're doing is stealing. What you're doing is illegal. You're stealing. Stop stealing from traditional birth attendants. You're collecting money." I'm like, "Collecting what money?" She said, "Oh, on your post, there's a post that says you're collecting money. You need to stop that. You've been stealing from traditional birth attendants." But she goes on and on and on and on, and then she hangs up on me. So at this point, I'm reeling. I'm not really sure what's happening. So then I hang up. I do the reverse search thing with Icanet, find out her name, and then I just post. And then it's only now that I Googled and I'm seeing that she does work for the ministry and she's some director or something. And I'm not going to let that scare me because I'm sick of it. I don't draw a salary from the work that I do with Rona Flow Foundation. I do it because God said it's heavy work. But I do it because God sent me. My mom died while giving birth at Harare, here in Harare, at Pararinga in Buyanehanda. Maternal health for me is not all like oral or theory. I lived it. Me and my siblings lived it. My mom was healthy 31-year-old who drove herself to Mbuyanehanda to go give birth to a baby, and oh fuck, I'm crying. And she didn't come back. She never came back. The doctor who made the fatal mistake is alive and well. So I know what it is to live with all this in my life. And I swore I would never allow any woman to die while giving birth like my mom did. This is why I do the work that I do. So that my mom's life has meaning to it. Her death and the death of the child she gave birth to, who's also gone, their lives have meaning. I moved back to Zimbabwe 2 years ago to do this work. I use my own resources most of the time. When I was in Toronto, me and my best friend, we had decent jobs, but to supplement, because we're both single mothers, we used to do housekeeping. And we would send them money, particularly when COVID started. We were supporting Jimbo Clinic in Chiweshe. Go to anybody in Jimbo Clinic and ask them, have I not helped? There was no donor who was doing that. I was doing that. Go to Harare Hospital. Talk to the matrons in charge who gave them PPE for the ward, what they called the red ward at the time, for the maternity unit. I was doing that. I give, and I use people that I know. I ask people that I know, please, can you help me? And people sow into me, and then I take those funds and I sow into the work. You have the audacity to say I'm stealing? Me who struggles to pay my bills because I get a call from a 14 or 15-year-old saying Mama Chipo andinakana chandinacho, and I sacrifice my money to buy a birth kit and I'm the one who's stealing? Okay, let's talk about the traditional birth attendants in Epworth. It's 65 of them. They're all led by Gogo Nyakudanga. I want you, whoever you are, Lucia, look for Gogo Nyakudanga. Go and sit with her and ask her, has Chipo ever taken a single dollar from you? I buy that woman food because what happens is sometimes when we get a 15-year-old and in Epworth, they live alone. I literally have to ask Gogo, please. I've told social work this child has just delivered. She cannot go and live alone with a newborn baby. Social work is not helping me. Can you take care of this child and teach her how to watch a baby, how to wash a baby, how to breastfeed at least for a week? And I give Gogo Nyakudanga food, sometimes from my own pantry, and I'm the one who's stealing? How dare you? I'm really, really hurt by that comment. I mean, the president keeps saying, oh, Nyikainova Kwanevenevayo, Nyikainova Kwanevenevayo. I'm trying to do that. Isn't that what we're all supposed to be doing, regardless of party affiliation, building this country because we're all in it? And then there are people like you who just want to come and harass. The harassment I go through doing this work, I don't even know why I do it. The car I'm using is my car. There's no donor who bought me that car. That is my personal car that I branded to make life easier for me so that I'm able to maneuver. And I'm the one who's stealing. The bottom line with traditional birth attendants is they are filling a gap, an important gap. There's an unofficial referral pathway from the clinic to the traditional birth attendants. Do you know that, Imimi Doctor? Do you know that the traditional birth attendants, Vakasunungutsa, Vanendesa Vana Iva to the local clinic, and the local clinic records those as live births? But Anambia Yamkuta Ndova Nenge Vasunungutsa. Do you know that? I have told Anambia Nyamkuta, let's do things procedurally. I'm the one who's actually stopping them from delivering as best as I can. Sometimes they will end up delivering because a woman comes and presents at their door. They have to do the humane thing and help. But that's why I keep asking, let's equip, let's train the traditional birth attendants. They are delivering babies anyway. You want to get to zero new infections by 2030. How are you going to get there when you're not having sober conversations with the traditional birth attendants and making sure they've got clean birthing utensils? How are you getting there? How are you getting to zero new infections? Tell me how that's happening. Tell me why you haven't put this traditional birth attendants in a room to understand where they're coming from. And tell me why the traditional practitioners authority of Zimbabwe is accepting my license fees. And I am the one who's even helping the traditional birth attendants to look for that money, because I want them to do things procedurally, because as far as they are telling me and as far as I know, they pay $25 in that building, Kaguvi building, to do the work that they do. So what is it? Which is it? Are they allowed to practice or are they not? And if they're not, why is one branch of government taking their money? That's all I was asking. Not for you to then look for my private number and threaten me in the morning. I thought I'm complimenting government efforts with all the work that I'm doing. And I say all the work I'm doing because I'm the only full-time staffer at Ronaflow. I have volunteers who come and go, but because I can't pay them, they come and go as they please. There's only been one consistent one so far, Terrence. And another girl, Samantha, who does our communications. Here and there she helps. But pretty much I do most of the work. I don't know how I do it, but I do because I'm committed. And then you have the audacity to say that to me. Everything that I'm meant to do, registration at Secretary Muguti's office, I've done. Application to get MOU with Ministry of Health, I've done. Gone to speak to the director of City Health, asking, how do I help? How do we help? How do we work together? Because one thing I know for a fact is I'm on the ground. I don't understand some of the interventions that we as Renaflo are doing and how big organizations are not doing it. Guys. Have you seen a 15-year-old struggling with a C-section scar? Achigara Ega living alone in a shack in Epworth. Who's attending to that? I've done everything I can. And then someone has the audacity to come and threaten me? Someone of that stature? So I'm not ever going to delete this video because I'm leaving it online for posterity. I actually cannot believe that she did that. I'm stealing. Chipo, Chipo, why are you doing this? This is insane. You're on a payment plan for your child's tuition and you do it, but because, you know what? You don't deserve my tears. Stay off my phone. If I'm doing something illegal, advise me, I will stop it. But so far, I've done everything procedurally. I'm just helping. Whoever you are, I want you to sit down with those traditional birth attendants and ask them if they've ever given me $1. I want you to ask them that. And stay off my phone.